Alrighty, so I'm going to check the patient's chart, review the doctor's orders, and gather up all my supplies before I go into the patient's room. Alrighty, hi Mr. Johnson, my name is Kayliana. I'm with Respiratory, and I'm going to come in and kind of explain to you some of the treatments that we're going to do here in the hospital, and then one that we're going to send home with you. So I'm going to first start by washing my hands. Alrighty, now if it's okay with you, I'm going to take your vitals and listen to your breath sounds. So I need 4 big deep breaths. And I'm going to listen here in the back, so 4 more. Alrighty, sounds good. I'm going to go ahead and take your heart rate here for 15 seconds. Alrighty, so I got your heart rate and your respiratory rate, and I'm going to go ahead and record that here. Alrighty, so we're going to be administering you 3 different types of medications today. So the first one is Duoneb, and this is a mixture of albuterol and ipratropium bromide. And we are going to be doing this through a small volume nebulizer, and this is going to be 4 times a day. So with this medication, there are some side effects, and these can include headache, dry mouth, or you can begin to feel nauseated. So let me know if you experience any of those. Alrighty, so with this small volume nebulizer, your medicine is here in this little cup, and it's going to start misting. And what you're going to do is you're just going to seal your lips here around this mouthpiece and breathe as you normally would, taking occasional deep breaths until it stops misting. That means the medication is gone. So we're going to do the treatment now. Perfect. Alright, and so the next one that we're going to do is we are going to do a medication called Foradil, and this is also known as Formoterol. We're going to do this through a dry powder inhaler. So what you're going to do here, this is the mouthpiece, so you're always going to exhale away from this device. That way you don't get any moisture inside the powder, and that way it won't be able to work effectively and it won't get in your lungs. So you're just going to seal, after you exhale away, you're going to seal your mouth around it, actuate it, inhale, then you're going to hold for 10 seconds, and exhale away. And then it's always a good idea to rinse your mouth out after using this. This medication can cause dizziness, tremors, headache. Those are all common. And then what we're going to send you home with is a metered dose inhaler, and this will be more convenient than what we do here in the hospital. And this is called Combient Respimat. And we're going to take this 4 times a day. And then, so with this, you can see short of breath or a headache. And so this is the mouthpiece here, so I want you to seal your lips around here. And inhale. Then you're going to hold your breath. First you're going to shake this. Then you're going to seal your lips around. As I push, you're going to inhale. Then hold for 10 seconds, or as long as you can. And then exhale completely. Perfect. So after all those, I'm going to check your breath sounds again and take your vitals. Here in the back. Alrighty, sounds perfect. I'm going to go ahead and take your pulse again. Alrighty, got your pulse and respiration. So I'm going to chart here that these treatments were effective, and along with your vitals. and my patient does not have any further questions. He understood the treatments and what he's supposed to do at home, and he is comfortable and doesn't need anything.